Hundreds of millions of dollars are going into a concerted misinformation campaign to scare people about health care reform and to turn the public dialogue into a war of words. In Spanish, there is a saying, dura la verdad, dura la mentira, hasta que llega la verdad. The lie lasts until the truth arrives. No one should make important life decisions without reliable information. Universal Healthcare Foundation of Connecticut is committed to making sure the public has the facts. We're here today to launch a public awareness campaign to ensure Connecticut families and businesses get the information they need to be able to make informed choices that save them money and help move our economy forward. We have no choice. Federal reform and sustainment add up to economic gain for Connecticut. But before we get started, I'd like to acknowledge all the people in this room who have been working with the foundation over these last several years. There are many of our partners here, consumers, business, industry, labor leaders, faith leaders, healthcare providers, and advocates. We're also joined by national and state experts working in partnership with the foundation, and you'll hear from some of them in a moment, and they'll be available to take questions from the press. The Health Care for Everyone Public Awareness Campaign is an aggressive, statewide grassroots program. It is aimed at raising the public's awareness of the effects and opportunities presented by health care reform, both the new federal law and sustainment, the new state law. It is timely because it is crucial that families, businesses, and policymakers take maximum advantage of the resources these reforms bring. The public awareness campaign will be conducted under the umbrella of Health Care for Everyone, a statewide advocacy coalition coordinated by the foundation. Coalition members will work closely in local communities with resident groups, civic associations, chambers and other business organizations, church and parent groups, to hold community forums, informational briefings, and other types of public awareness activities throughout the rest of this year. The Health Care for Everyone public awareness campaign identifies and trains local people to reach their business associates, friends, neighbors, and family with up-to-the-minute information about how implementation of federal reform will affect them and state and federal policy issues that they should care about. We understand that small business needs relief from this economic environment. That is why we started the Health Care for Everyone public awareness campaign today with a standing room only briefing for Connecticut businesses right in this room this morning about what sustainment and federal reform will do to lessen their health care costs and improve their competitiveness in business. Future events will be announced on our website and the websites of our partners. Connecticut faces unprecedented economic and state budget problems. Federal and state reforms are not perfect, but together they do hold the key to making Connecticut a good place to live, work, and do business once again. It's why the Health Care for Everyone public-private coalition will continue to ensure that elected officials are accountable for the successful rollout of federal and state reforms. Connecticut is on top of it. Connecticut began last year to prepare itself for federal reform by passing the sustainment law so that we could be ready with the kinds of reforms needed to improve health, control costs, and assure quality care to Connecticut residents. Like federal reform, sustainment was passed with a thoughtful graduated implementation schedule. The foundation and its partners are closely following the sustainment board responsible for implementation of health reform in Connecticut. Wisely, lawmakers anticipated the need to identify the major ways Connecticut would have to respond to federal reform. So the sustainment law requires that the board submit a report to the General Assembly within 60 days of the President's signature enacting the federal reform bill. This does not mean that the Sustanet Board has to make its final recommendations within 60 days of federal reform. It means it has to explain to the legislature what kinds of accommodations and adjustments will be needed in order for Connecticut to conform with the federal reform.